Hey everybody, it's Dr. Seiler from Seiler Skin. Hope y'all are doing well. If y'all been watching our social media lately, we've been doing a lot of information giving and blogging about how to address the lower face, especially since it's mask wearing season, so a lot of people have increased doing their lips and around the mouth. One of the things that I'm a big fan about telling patients and people that I train is that you really got to focus on the use of both Botox and filler in the lower face, what we call our gravity fix solution therapy here. So one of our lovely patients here, she's done the vampire facelift this year. She's got a nice lift to her cheeks and her lower face with that treatment. She's had one syringe of Velour, one of our thinner fillers in the lips. It was the one and only time that she did the lips. And she was happy with it, but wished that she had had just a little bit more volume. So today we're using Versa. This is one of our newer fillers. It's great. It's kind of in between Velour and Juvederm. Gives a nice volume. It's not as thick as Juvederm. It's got a little bit of lidocaine in it, so you'll see that just with a little bit of ice, she tolerates it great. So we're going to get to it. We're going to start injecting. I'm going to do a little bit of alcohol. We've already cleaned her skin. If you've ever watched any of my videos, I'm really obsessive about keeping the skin good and clean. Cindy's going to show me all of our little blood vessels around the mouth there with, let your mouth just kind of relax open. The AccuVein is our favorite tool to show the little blood vessels on the skin and even deepen the tissue so that we'd really reduce the risk of bruising. Aspirate a little bit here. Do a little bitty injection. And you can see she's tolerating this fine. I'm going to do just a little bit in the corner of the bottom lip and then really focus on the upper lip here. So I've termed a phrase called gravity fix, which is looking at the 5 proportions of the face and treating the 10 areas of the face, all of which need Botox, and a lot of which will eventually need filler. All right, let's ice there just real quick. And if you're afraid to get your lips done, don't be afraid to get your lips done if you come to the right person, especially somebody like me that does lips all the time. I use several different fillers, so we don't have a one-size-fits-all. We really tailor it to what you're looking for. A lot of people are afraid that we're going to make their lip too big or that it's going to hurt, and really neither of that is the case. If this is done correctly, patients are always amazed if they've had filler done before that it really doesn't hurt hardly at all, if at all, when I do it. And we don't have to waste time numbing. I don't have to do dental blocks, make you all numb afterward. Just a little bit of ice and a little bit of the little skin wiggle, and that usually is enough to... If you're watching this for training purposes, you can see that I do like to massage it just a little bit and manipulate it when I do the corners right there. All right, let's look again real quick. Again, we'll look to see where our vascularity is. Do a quick little wipe since my glove touched the skin there. All right, little stick. This has really become one of my favorite fillers. I like all the fillers I use, but people really like Versa in the lips. It's smooth, but it's still thick enough to give you some nice volume, but it's not going to swell like some of the other fillers do, which those that do is good if you want them to swell and kind of thicken, but Versa is kind of what you see is what you get. Hurting at all? No? Good. All right, let's ice right there in the center. And this is a pretty quick treatment. I mean, it usually only takes me about 10-15 minutes to do a set of lips, especially if the patient's had them done before and they kind of know what to expect. And the Velour that she had before, it made her happy. She liked it. It was her first time. She wanted to be real conservative. Most people end up wanting a little bit more in their second treatment, so if we start with one of the thinner fillers to get the patient used to a nice change but not too much, then we have several fillers that are a little bit thicker that we can bump to in the next treatment. You can see I'm just doing small injections. You're going to love this, I can tell. The other thing I like about Versa is even though it's, you know, it's thick enough to give you some nice volume, it's still malleable, so it just kind of integrates itself into the tissue really nice. I've been using it for the better part of this year. Haven't had anybody not like it. Everybody's just loved it. No one feels it in their lips afterward. All right, let's actually get right on the tubercle. So this is an interesting little shot. This is something that not everybody knows to do, but it's important to look at the Cupid's bow. And even though she looks good and she's got pretty good structure to her lip, she's lost that philtral column right there, what kind of gives you that little Cupid's bow perk. All right, let your mouth kind of open just a little bit. There you go. All right. So what we do here is we do a little pinch so she doesn't feel it. I do a little bit of injection right there, and then I go deep with this, kind of close to the nostril. So you're going to feel the lidocaine kind of kicking in a little bit. And then I do a little injection as I'm coming out. And this gives them a nice little perk right there. And it also helps to kind of flip the lip a little bit. If you've watched our information and blogs about Botox, we do Botox in the lips and the lower face to help give a little bit of show. So a lot of patients need both Botox and filler. It all depends on whether it's more muscular or volume loss or both. So you probably have not heard a lot about Botox in the lower face because most people don't do it, but it's something we do all day. You doing okay?
Mm-hmm.
Feeling kind of numb?
Mm-hmm.
At this point you might feel like your lip's kind of big just because of the numbing that's in it. So we haven't used even half a syringe yet, so I'm going to come back here and do just a little bit more. All right, let's look again right there in the upper corner. By now you ought to be pretty good and numb. Do a little bit more right there. And you can see that every time that I do it, I go in slow, I aspirate to make sure that I'm not near or in a blood vessel. That keeps us safe. And then, like I said, on the corners of the lip, I always kind of massage a little bit. You can tell that I didn't massage as much when I got to the middle part of the lip because I want it to stay right there. Again, if you're watching this for training video purposes, always hold pressure if you see even just a little spot of blood. That's all the difference between a bruise and no bruise. And 9 times out of 10, my patients have very, very minimal bruising. All right, let's look right there. Let's put a little alcohol. Do a little alcohol wipe. I treat filler like it's an implant, so I'm always using alcohol on the skin to make sure that we're as clean as we can be. All right, and we've taken her pictures, and so we'll show these before and after pictures on our website. The other good thing about Versa is that it's thick enough to put here in the corner of the mouth. So what this little bitty shot does right here, and you don't have to put much, you just kind of let your needle be kind of medium depth right there. Usually the patient doesn't even feel it. And you do just a little bit right here. It's a subtle amount of filler, but it's just enough to kind of get that corner of the mouth to turn up. And Versa will thicken a little bit, so she'll see a better result in a couple of weeks. But you usually walk out of here with a good result, with very minimal swelling or bruising at all. If the patient ever does have a tiny little bruise, we can always zap that with the IPL the next day, which makes it go away very quickly. And so check out Versa. This is one of our newer fillers. We're really excited about it. We can use it in multiple different areas. We can use it in the nasolabial fold. It's good for under the eyes too, but I'm using it a lot in the lips now. And it's a nice in between our thinner and our thickest fillers. So now we have even more options depending on what you're looking for. And you can see she tolerated this great. We're going to do the other side here in just a second.
Lean and show.
What's that?
You can get a good view of the one
And
side versus the other.
And again, like I said, nice subtle difference. So we don't have to make the lips too big. If she wanted even bigger, we could go with Juvederm. So nice little improvement there in the lips. We'll do the other side here in just a second. Thanks for watching.